let me just take a moment and introduce our keynote speaker. So it's my pleasure and I'm honored to introduce Dr. Diego Olego, the Senior Vice President and Chief Strategy and Innovation Officer at Philips Healthcare. Just a little bit of background on Dr. Olego is that he joined Philips in 1986, and during his career with Philips, he has held several leadership positions in research technology and innovation management. At Philips Research, Dr. Olego has managed technology programs and research projects in solid-state electronics, displays, software development, and medical instrumentation for new products. That really does span all of Philips, not just healthcare. In 2005, he was named the Senior Vice President and Chief Technology Officer of Philips Healthcare, where he became responsible for the innovation strategy, the technology investments, and the research directions of the medical division. Most recently, in April of 2012, Dr. Olego was appointed the Chief Strategy and Innovation Officer, again, of Philips Healthcare, now spanning multiple domains. By way of education, I think all of you should know that Dr. Olego holds a Master's of Science degree in Physics from Cordoba University in Argentina, a Master of Business Administration from Columbia University, and a Doctor of Philosophy degree in Solid-State Physics from Stuttgart University in Germany, thus proving that physicists are people too. So with that, again, it is my honor to welcome Dr. Olego to the stage and have the discussion on accelerating time to market globally. Thank you. Probably don't want to come behind here.
Yeah, well, thank you very much for the very kind introduction. And we're really very excited about the partnership that our company just established with the Georgia Region's Health Center. And we're also really looking forward to becoming a partner on your regional innovation drive, a partner and a stakeholder on what this region can offer, and be participant of all your very exciting ideas. It's really an honor for me to open this innovation event, and I'm really humbled by being able to address this audience today. Now, I have been asked to talk about accelerating time to market in healthcare. And what I will do is I will be talking about accelerating time to market in healthcare and put that into the context of innovation. Now, I know that many of you in the audience are not necessarily from the healthcare business. So it's typical, particularly when you have a speaker from an academic center or a clinical site talking about healthcare, the first thing that they need to do is disclose conflict of interest. Well, yes, indeed, I do have conflict of interest because I do work for Philips. So when I show examples, the examples I'm going to show are examples where Philips Healthcare is involved in innovation. But I trust that you could be able to abstract from those examples and translate some of that to whatever field you are involved in. So if I can have the slides. So again, as I said, I will be talking about innovation in healthcare to accelerate time to market. And as we move through the talk, I will basically bring this notion of innovation at the intersection. But let's first define innovation. Some of the previous speakers have already alluded to innovation. So let's define innovation. A lot has been written about innovation, so I'm not very original here. So I picked up some of the quotes, and the one that resonates with me is the ones that I'm showing here. Is something new, be a product, a solution, a business model, that fulfills a known need or an unknown need, but people need to adopt that, and they have to have some economic value. They need to be able, or they need to be willing to pay for it. So this makes a distinction between innovation and invention. So invention is a necessary condition, but it's not sufficient. And when I talk about innovation in healthcare, please keep this in mind. So at the end of the day, whatever we do has to be adopted, which means that we need to place innovation in healthcare and acceleration of time to market in healthcare in the context of what are the challenges that healthcare is facing today worldwide, as well as look at some of the paradigm shifts that are taking care in healthcare today. So let me review briefly what those are. For once, the world population, in a way, is becoming older. So life expectancy is increasing, and this is a phenomenon not only in, let's say, US or Western Europe. Some of the Asian societies, China and Japan, for example, are showing a very, very rapid increase in the population age. So nothing wrong with that. However, given that we're becoming older, and thanks to and credit to modern medicine, there is a rise in chronic conditions. So conditions that in the past were terminal today can be managed over a long period of time in a chronic fashion. So that in itself, as I said, helps prolong life, but also places a huge, huge burden into the economics of healthcare. Some numbers here of what it's the total cost of treating these diseases over the next 5 years, I believe, here in the US. And this takes into consideration not only the care that needs to be provided to manage these conditions, but also productivity loss of people who are afflicted with these maladies. Now, another thing that is really a very big challenge is consumerism in healthcare. What it means here is delivery of care to the point of care. Right now, everywhere in the world, we might be starting from a different point, but people want access to health care. They want access to better care, and people who did not have care before, they become more educated. The world is becoming more affluent, and hence we demand access to health care. So this, in a way, is a little bit of a triple, let's say, a perfect storm. We're getting older, more chronic diseases, and people want to have more access to health care. But worldwide, what we're seeing is a shortage of healthcare providers. So that places also a boundary condition to the system. And last but not least, there is a huge trend worldwide in urbanization. With urbanization comes a more sedentary lifestyle, and we are not helping ourselves because we are living and starting to adopt unhealthy habits. And that is creating some, first is reinforcing some of the chronic conditions that I talked before, and is creating new epidemics like the diabetes epidemics that right now many, many countries are starting to face. Big challenges facing healthcare, and these are not just the US. Here, this, as I said, these are global challenges for healthcare. Now, to respond to these challenges, innovation is fueling, I think, very important paradigm changes in healthcare. So let me briefly review some of these paradigm changes. So, yes, we need to learn how to manage populations, but also we are really after more personalized diagnosis and treatment. So we need to be more precise on the diagnosis and also on the treatment. It's becoming very, very evident in the oncology domain that you need to be much more specific about the condition of the patient. And, treatments that were broadly applied in the past now have to be narrowed to a much smaller cohort of patients. we're moving from basically diagnosing and treating at the organ level to trying to understand disease paths. Basically, what are the root causes of the problems that we see that manifest themselves in organs, but they might be, basically might have just a common condition, a common root, and you want to go and treat them at the root, irrespective if later on manifests itself in the liver, the lung, or the brain. There's a big, big push to move to minimally invasive procedures. There are many, many reasons why we want to do this, and there's a lot of work going on right now, and it's a huge paradigm change. Open type of surgery is more and more given way to minimally invasive. Huge data is being generated, and we are starting to manage and make information out of that data that will help care providers to tailor the therapy, to tailor the care, but also have upfront a much better view of what the outcome could be if I were to do ABC. And finally, and again, in part driven by some of the economic conditions in healthcare, and again, this is everywhere in the world, there is a big, big drive, a big paradigm in trying to optimize the care continuum. What do I mean by optimizing the care continuum? Making a seamless integration from prevention, screening, therapy, monitoring, and subsequent follow-up. Making sure that all the stakeholders in that continuum have proper hands-off as you move along, excuse me, as you move along this continuum of care, and trying to enable flow of information from one end to the other in a more seamless way. So these are paradigm shifts that are taking care in healthcare right now, strongly fueled by innovation, and in part are in response to the challenges that I mentioned before. So all this introduction, and I need to come to the definition of accelerating time to market. What does it mean? Well, at the very high level, you could say, well, accelerating time to market is innovate, accelerate these paradigm changes in order to deal with the challenges. Yeah, that's a working definition of accelerating time to market in healthcare. But we can go perhaps at a lower level in a more specific way. And I will say that accelerating time to market in healthcare means enabling solutions that provide the shortest path to the most appropriate care, giving rise to the best patient outcomes at lower cost. A lot of boundary conditions in this definition, but I believe that this is what accelerating time to market is in the healthcare domain. So we need to make sure that we invent, that we innovate. When I said the most appropriate care doesn't mean necessarily the hospital, is the lowest acuity setting where you can provide care with very good outcomes. We need to ensure clinical outcomes, and last but not least, we need to make sure that we provide good economic value for what it's been innovating. So that's the working definition of accelerating time to market in healthcare. And as I said before, innovation plays a very key role, and innovation is, in a way, the engine that is making these transformations. So for the rest of the talk, I would like to now look what type of innovations are the ones that have the better likelihood of accelerating time to market. And I postulate that those innovations are the innovations that take place at the intersection. So what are these intersections that I'm going to be talking about? And probably my list is not exhaustive. I'm sure that you can find other examples as well. So what are these intersections? One is intersection of disciplines. Another one we'll discuss the intersection of core competencies. intersection of private-public partnerships, particularly to localize healthcare solutions. And the fourth one that I'm going to be talking about is what I will call an intersection for rapid prototyping in healthcare. Now, before I go now into the examples and put a little bit more clarity what I mean with these intersections, you probably have heard a lot about open innovation, crowdsourcing, social networks for innovation. All that is very important, and for me, those are the enablers. All these intersections borrow and use methods that indeed have been developed in open innovation. You could use crowdsourcing, you could use any other method. For me, those are enablers that basically oil the machine at these intersections. So very, very important. I'm pretty sure we're going to hear throughout the summit about, definitely so in the program, some crowdsourcing type of activities for innovation. Very, very important, and again, enablers for these innovations at these intersections. So let's start now with some examples so I put a little bit more meat on the bone on these concepts. So intersection of disciplines. What do I mean here is when medicine, science, and engineering come together. So that has been the more traditional paradigm of innovation. But if we want to accelerate time to market in healthcare, it's very, very important all these disciplines come together at once. And one examples that of innovations that have gotten to the market rather quickly, I would say, for healthcare standards, coming out of these intersections are displayed here. And there are many, many, many more. So I just took a few examples. So the revolution that is going on in imaging, bringing digital technologies into pathology, advancing biomedicine by basically analyzing data, and among other things, enabling independent living. All these are examples, to some extent, of point solutions that come together because of this intersection of these many, many disciplines. Here is where, in a way, the individual inventors push the boundaries, but an individual inventor alone doesn't cut it. I mean, it needs these days, as I said, the confluence of many other disciplines in order to accelerate this time to market. And let me give you just one example. I can use any of these, but let me use the case of this biker. This is a real case. Is somebody who has obstructive chronic pulmonary disease, but he wants to ride his bike across all the states in the US. And he can do that because of a fantastic innovation, namely a miniaturization of a portable oxygen generator. And that machine came together, again, because of the confluence of fantastic miniaturization in electromechanical engineering, plus the medicine that goes into what he needs for his conditions, plus some decision support system that is monitoring how he's doing as he moves along. So that's one example, all these disciplines coming together. Let's move on to other type of intersections. And the other type of intersection I will be talking about deal more with, instead of point solutions, more what I will call an end-to-end approach to solving some of the problems in healthcare. Let's talk about core competencies. And I will start saying, let's look at Philips. We have been in the diagnostic imaging development business for, 50, 60 years. Over all these years, we have developed a very, very strong core competency in imaging. So we believe we know where imaging is going. We believe we know what is possible in imaging. We believe which technologies could be disruptive, what is on the horizon, what has worked before, what hasn't worked. It's a huge body of knowledge that in a way comes because of the previous intersection, right? So where all these disciplines come together. So how do we use this core competency innovating at this intersection? Well, let me give you this example now. So this example is a high-risk plaque initiative to predict the risk of stroke and heart attack. So what we're after is there a way through a biomarker, be an imaging biomarker or a blood biomarker, to predict what's the risk that the plaque that somebody has in the arteries will rupture and will trigger a stroke or a heart attack. We need to look at this end-to-end because this has to do with prevention, has to do with diagnosis, and later on has to do with therapy. All have to come together. We don't have all these competencies in-house. So we are innovating together with all these other partners. So we bring the imaging component. We have Humana, because this is a longitudinal study over several years. Humana brings the knowledge about managing the patient population. Mount Sinai from New York, the clinical knowledge, and a cohort of pharma partners that know about in vitro biomarkers, as well as the pharma therapy for the condition. All working together, innovating together, and we are in the midst of this innovation as we speak. And as I said before, what we're trying to do here is, can we image the plaque in the arteries? And if you can image that, can you somehow determine what's the probability that that's a plaque at risk and can rupture going on? Again, that's kind of an end-to-end type of innovation that brings many, many different core competencies to the table. The next one that I want to also show as an example is an innovation, again, in its infancy, about, how do I come back? Let me see. Yeah, sorry. So this innovation is, how do we biopsy through image-guided interventions the prostate? So the prostate right now is one of the very few organs in the body that we biopsy blind. What it means is the doctor goes, yes, has some idea through ultrasound where the prostate is, but he or she doesn't know where the malignancies might be in the prostate. So what is being done, so 12 or 16 needles are being just used to biopsy the prostate with the hope that one of these needles might get something. So that's not a very satisfying situation for somebody who has to go through that type of procedure. So what here is happening is, again, we bring our imaging core competency, because there's a lot to go on how to image the prostate. The National Institute of Health brings their clinical knowledge, but also their ability to translate whatever happens in the laboratory into the local healthcare systems. And in vivo, in the meantime, Philip's company, that they have a lot of core competencies on navigations of instruments for biopsies and therapies. And what we're trying to do here is determine with magnetic resonance imaging where the problems are in the prostate. And when you have determined where they are, later on you can go with electronavigation of the needle and try to place the needle with millimeter accuracy exactly at that point, just one needle, not 12, and you know exactly where you're going and not going blind. But again, why is this important? Why do we think we accelerate time to market? Is, okay, is something that is not happening inside a laboratory, and later on you have to convince a clinical center, and then you have to translate that to, the healthcare community at large. This is being done, as I said, with the National Institute of Health. If this is successful, they have the core competency of how to pass that to the local community type of health delivery systems. So these are two examples about bringing this innovation at the intersection of core competencies. Let's move on. And I want to talk about this other intersection, which is the private-public partnerships for localized solutions. And I will give one example, although there are more than one. And this is becoming more and more relevant because, let me set the stage. In many parts of the world, it's relatively, how can I say it, easy. I know it's not easy, but in the scale of things, it's easy to donate equipment. So you go, donate the equipment, everybody's happy. But it so happens that nobody knows how to use the equipment. There is no training. There is no sustainability for the maintenance of the equipment. And the local healthcare providers are not, let's say, trained to use the equipment or to deal with the conditions they're going to be dealing with. So this type of partnerships become very, very important. And I give you the example we're involved in. So we have 3 or 4 of these innovations, because this is really innovation around the world. I will just use this as an example. And the example here is how to bring comprehensive women's health care to remote villages. This particular case in India. And this private-public partnership involves us, involves RAD8, which is an NGO organization that provides and trains people to be able to deliver in a sustainable way radiology services, and PICMER, a local healthcare provider in India. So these organizations came together, and yes, we were willing to retrofit this van and put mammography equipment and put equipment for bone densitometry and put equipment for gynecological type of exams to determine cervix and uterine cancer. But we said this is not going to make it. We need to find, again, an end-to-end way that the system becomes sustainable, that people are trained, that we know how to take the images and the data that gets created and gets transported to the hospital that's going to read it, find a way also through spatial compression algorithms to move that data back in real time, if possible, so the woman who is being diagnosed immediately has the results. And last but not least, what happens if you find a malignancy? It's not sufficient to say, well, you have these problems, and now we don't know what to do with it because you are too far away from the clinical site, et cetera, et cetera. So that necessitates that you take a step back and say, okay, let's do basically a systems engineering. How are we going to deliver end-to-end? And clearly, we alone cannot do it. PICMER, the healthcare provider, alone cannot do it. RAD8 alone cannot do it. So we're working all together to try to enable this end-to-end delivery of women's health solution. And I can tell you that this is making tremendous amount of progress. We are involved in similar undertakings in Africa and the Middle East. And it's creating a huge amount of innovation. So this is innovation with a purpose. It's innovation through a partnership, private-public partnership. But every member of the partnership is learning as we move along. And the solution gets adopted. So this is a typical example of accelerating through innovation, healthcare delivery, and time to market. The last one that I wanted to discuss today is something that we need to do more of in healthcare, and I will call it, for lack of a better word, so innovation and the intersection of rapid prototyping. In many areas, healthcare has been too linear. So we have embarked in multi-year type of endeavors to find, after millions, hundreds of millions of dollars at the end, that the outcomes are not what we expected, the economic value was not what was expected, et cetera, and the solution was never adopted. So we need to start borrowing from other industries and start thinking on methods that preserve, of course, the care that you need to provide to the patient. But having said this, we need to start borrowing from other industries how we can more rapid prototype, create an hypothesis, do the experiment. Does it confirm? Yes. Build on that. Does not confirm? What went wrong? Let's go back to the drawing board. What do we do next? Et cetera, et cetera, et cetera. So that's something that the healthcare needs to, as I said, become more used to. And of course, I'm not advocating that we're going to lower the standards of care or that we are, going to, not be looking to all the, boundary conditions that are necessary when you do rapid prototyping. But that's something that, again, it's something that we need to do more of. And two examples that I want to mention here that we are doing, again, in order to accelerate time to market. One is a relationship we have with Banner Health. And the issue here is, how do we provide care for what we call complex patients with multiple chronic conditions? So in other words, is what in the jargon is called the intensive ambulatory care patient. And for most care systems, these intensive ambulatory care patients, they are 5 to 10% of the patient population that they need to deal with. But in many cases, they represent 40 to 50% of the cost of delivering total health care. So it's a very, very demanding population given the condition, but it's also placing huge, huge strains in the economics of healthcare. Well, with Banner, we're trying to develop a system, right, that allows for telemonitoring of these patients in the homes. So the first thing that we need to do is, can we deliver care in the home the same way that you would deliver care in the hospital? We're enabling these patients to manage their own conditions by very creative, self-managed type of advice through interactive means. We're also providing the healthcare with decision support tools that can anticipate when something is wrong if the patient is being treated at home. So let's please come back as soon as possible. And when I call here rapid prototyping is because there are certain hypotheses. The hypothesis is, yes, we will be able to manage, or Banner Health will be able to manage these patients at home. Yes, by managing these patients at home, there will be more efficiency in the system and better workflow and reduced cost. Those are hypotheses, needs to be proven. And there are too many variables in this experiment. So, we are going, not reducing the standard of care, but willing to modify it as we move along and make decisions. Does it pay off? Do we continue or not? So that's a new paradigm on how do we approach this type of innovations. In the past would have been, okay, we think that this is what's going to happen, so you go into a 5, 6, 7 year type of study to find out at the end that outcome was not better or cost was not reduced, in which case you wasted all this time and years. And the other example that you know, it's very, very ripe for rapid prototyping, is what I will call healing environments. Which basically provide outside stimuli to the patient, because the hypothesis is that if you do that, patient is more relaxed. When the patient is more relaxed, the workflow is much, much better. And among other things, you can reduce sedation for the patient. You can reduce the amount of imaging agents that you have to inject in order to conduct whatever examination. That's an hypothesis. And we are right now, as I said, in the rapid prototyping stage with different institutions. And yes, in some cases, the hypothesis is being confirmed. So we are, you know, building on what we learn. And the next hypothesis is, okay, will this deliver better outcomes? That's an hypothesis. I cannot claim that that's the case, but again, that's the next, you know, the next frontier in this innovation. And the only way to do that is not wait 10 years to find out that that was not the case. It's something that, you know, you modified your hypothesis as you move along. So these are some examples of how innovation takes place. Innovations that, if successful, will find their way to make an impact into healthcare, hence accelerating this so-called time to market in healthcare. So, coming to the end of the talk, I want to leave you with the following notion, again, repeating, healthcare is facing huge, huge challenges, but there are very profound paradigm changes taking place in healthcare. Innovation is key, and I believe that the more we innovate at the intersection, the more we will be accelerating those innovations being accepted by the healthcare systems, because they will provide better outcomes and they will deliver value at equal or lower cost. So thank you very much, and I will be more than honored if you have any questions.